thought about the way that nutrition supports your healing pre and post-op for your hip, or if you're going through menopause and you have joint pain. Now, I teach both kind of things. A lot of women in my class, a lot of people who have had hip replacements that have to be a woman. And I was asked a question about, what if you were vegan? Because some of the things we talk about is the role of collagen. So I'm going to quickly go through what the current scientific research seems to indicate in terms of how food can help alongside exercise. Don't get me wrong, you've got to do the movement before and after your hip replacement. So remember, food does not replace the surgery, the physiotherapy or the medical care, okay? But good nutrition gives your body the kind of raw materials that it needs for healing the wound, muscle repair, your energy, your immune function, bone health, joint pain, rehabilitation. And, remember, after your hip, your body's not just resting, it's actually repairing tissue, managing inflammation, rebuilding strength, maintaining blood volume, healing the wound, and adapting to movement again. And the NHS says that recovery from hip replacement can take months, and early walking plus your physiotherapy are really key to long-term hip and strength movement. But nutrition matters because after surgery, the body needs protein, energy, vitamins, minerals, fluid to support the recovery. The Royal National Orthopaedic Hospital advises that good nutrition after surgery can reduce complications, support immunity, wound healing, and maintain muscle strength, and may reduce hospital stays. So to begin with, we want to think about protein. Now, protein is really important after surgery because it helps maintain muscle and provides what are called amino acids, or the building blocks for tissue repair. Now, after hip replacement, people are often less active, okay, understandably, and they might have a reduced appetite. That's fine. But this combination of not moving and not eating well can lead to increased muscle loss if kind of your protein that you're eating within your food is low. So try to think of it like this. You don't want to overload the gut and eat your protein all in one go. You want to have your protein spread out throughout the day. So you can think of your protein from things like animal products such as eggs, fish, chicken, or, Greek yogurt, milk and cheese, or more vegetarian style like tofu, tempeh, soya, beans, lentils, chickpeas, nuts, seeds, etc. We kind of have a look at the way that how much you should eat, but also we need to think about the way that the gut health changes as we get older, especially if you're over 50 and especially if you're in the menopause, that we have this kind of anabolic resistance and we cannot absorb the protein in the same way. So when we want to think about eating, like leading up to the operation, so we're in top peak form, or after the operation, or whether you have any kind of joint pain or muscle ache in menopause, it's a way of thinking about it. Now, people sometimes think like, well, I'm not doing much, so I should eat less. But, but after surgery, your body might need more nutritional support, not less. And if the intake of protein is low, the body then might seek the protein from your own body. All right, so if you're trying to repair the wound and you're not eating enough protein, it will break down other muscle tissue to support that repair. So think of it as not a time of severe restriction, it's a time of very structured planning of your diet and nutrition. So diet is what you eat on a daily basis, and the nutrition is what's made up in your diet. So if your appetite is low, have smaller meals throughout the day. Drip feed your protein. So think of things like yogurt with fruit and seeds, soup with maybe added lentils or beans in them, scrambled egg on toast, have some hummus with some oat cakes, say, for example, or make yourself a smoothie that's got banana and nut butter and milk and stuff like that. The other vitamin we need is vitamin C. So vitamin C is needed to make what's known as collagen. So collagen is a protein filler and helps with wound healing. It also helps absorb iron from the plant foods. And we need the vitamin C on a regular basis. So things like berries, kiwis, citrus fruit, peppers, broccoli, potatoes, Brussels sprouts, leafy greens, so dark things and bright things. So think about lentil soup with peppers, whole grain bread, and then some fruit for pudding, or salmon, potatoes and broccoli for your main meal with some berries and yogurts. Iron is also important because we want to maintain the hemoglobin, which carries oxygen in the blood. And this is really important after surgery because fatigue is very common and oxygen delivery is so important for healing, which is why we want to keep moving as well, all right? So food sources that have high levels of iron are, of course, red meat, fish and eggs, but also beans and lentils and dark green leafy vegetables, dried fruit, nuts, seeds and fortified cereals. So think of things like beans on toast with some tomatoes. Think about maybe doing a stir fry with lots of broccoli and kale in it. Zinc is also important because it supports immune function and the formation of new skin tissue. Zinc helps with wound healing and can be found in foods like lean fish, meat, shellfish, cheese, beans, etc. Think about this. Put some pumpkin seeds on top of your soup or in your porridge. Add lentils to the soup that you've already done. Now you can buy lentils in a can. You don't have to cook them. Cook them is easy and keep them in the fridge and just add them in. Have nuts in your yogurt. Make sure you've got whole grain bread with your hummus. Calcium and vitamin D are the other two. So hip replacement recovery is not just about the wound, it's about restoring confidence and strength in the load-bearing capacity around that hip joint. And calcium and vitamin D can support this. And it's especially relevant if you're postmenopausal or anybody at risk of low bone density. I'm famously known for saying sardines because they have a high level of calcium. But luckily, if you don't like sardines, then milk, yogurt, cheese, calcium fortified milk, calcium set tofu, tinned fish with bones, leafy greens, anything like that. Vitamin D is harder to obtain from food alone. So many people are advised to take a supplement during the autumn and the winter, but with the weather like it is at the moment, 15 minutes a day is a really good way to up your vitamin D level. The other thing I would say, and having somebody who's been through major operation, you have to think about your fibre and fluid because constipation after surgery is very common. And you do not want to stress out your body anymore or feel like you're straining against scar tissue. So, sometimes it's the pain meds we're taking, sometimes it's the anaesthetic. So lots of fluid. Have a water bottle. I particularly like having like a metal one of 1 litre, so I know exactly how much I'm drinking in the day. But you can also have your fluid from, fruit and vegetables. Think about things like prunes and kiwi fruit, which are really good. Lentils, beans, edamame seeds, but also put things in like flax seeds and chia seeds. Anything that helps your fibre. So if you added fibre to every meal and you made sure you drank a glass of water with every meal and you were eating in a regular way, you would be able to cover all of these bases. The final one I'm going to talk about is omega-3. Now, we know that inflammation can be like, it's anti-inflammatory, we want to avoid inflammation. But inflammation actually helps the body to heal. We know that when we have a high temperature, it is that burning sensation that is killing off the bacteria. So inflammation is part of healing and we don't want to block it out completely, but we want the body to be able to resolve the inflammation. We know that Mediterranean style of eating pattern with oily fish, olive oil, nuts, seeds, vegetables and legumes can support both your heart health and your metabolic health, which is really, really useful after hip replacement, because the recovery is not only about your hip. You cannot look at one part of your body and go like, this bit needs dealing with. Your body works as a whole unit. It's about circulation, it's about your energy production, it's about managing your weight, it's about your blood glucose levels, your sugar, your insulin, and it's about that recovery. So omega-3 are found in oily fish, salmon, sardines, mackerel, trout, but also in walnuts and chickpeas and chia seeds and flaxseed and olive oil and avocado, anything like that. Remember, if you're on blood thinning medication, please, please, please check with your surgical team before taking any omega-3 capsules. So hip replacement is not only a joint thing. You have a major recovery process going on in your whole body, and your wound has to heal. Your muscles around the hip have to repair. Your strength and balance walking pattern have to build. And you have to think about ways that food gives you the building blocks to be able to repair tissue. And we want to repair the tissue as well with movement. And the movement has to be appropriate to the phase of recovery that you're in, and supported with your physical therapists and your mental health and your medical health, team. So think about this. Plan your exercise and movement, but support that with the food that you eat. I hope that helps, and I'll speak again soon. There's also a handout. So if you want a handout, comment HIP in the comments and I'll send it to you.